Well, I think my sports background is probably makes me a little bit unique because I was a Division I athlete and competed nationally for the United States, and I think having been hurt before and having been through some of the things that patients go through, you kind of seen it on that side, and so I think that's probably a little bit unique to my practice. Well, when I got into it, obviously I liked the sports background aspect of it, and I had been around quite a few orthopedic surgeons and followed several of them when I came home from school. Folks in the community where I grew up, I would go shadow them, and really liked it. And so I thought, when I went to med school, unless I really liked something better, I was going to try to do orthopedics. I'm a perfectionist when it comes to surgery, and so I certainly don't like complications. No one does. I like to try to make things as good as I can make them, and as good as humanly possible. Well, I think it's a unique specialty in that it really spans the entire lifetime of humanity. You take care of infants when they're first born, with hip dysplasia, all the way up to the very elderly with hip fractures and other traumatic injuries. And so there's not very many specialties that take care of infants all the way through, and I think that's unique. I think also the fact that we're kind of fixers, particularly with orthopedics, that you're able to take someone with a fracture and fix it, and they heal and go on about their life, and they're not coming back every month, needing to tweak their medicine or having blood sugar issues or blood pressure issues. And so it's nice to be able to help people in that way, where you can sometimes operate on them. Sometimes you don't even need to operate on them. You can give them a cortisone injection or some physical therapy, and they get better and have a better quality of life.